Hello and welcome to another acupressure video. This one is going to be on acupressure to relieve knee pain. Now, knee pain is something I really love to treat in my clinic. I love seeing people who are otherwise relying on canes, crutches, walkers, loads of painkillers, be able to let go of these supports and seeing them walk easily, just starting to get more of their life back. I love that. Now, there can be many causes for knee pain, from arthritis to ACL injuries, fractures, torn meniscus, knee bursitis, patellar tendonitis, mechanical issues such as iliotibial band syndrome, dislocated kneecap, the list goes on and on. So when there's inflammation present in the knee area, we may see swelling, redness, loss of function, like inability to, bend the knee or trouble climbing the stairs. We might also see tenderness or warmth, feeling of heat in the knee area. Now, if you have any signs of inflammation or become unable to bear weight on your knee or extend or flex the knee fully, or if you have a fever or any kind of severe injury, then of course, please check with your doctor as well. So let's talk about what causes pain from an Oriental medicine perspective. At the root of all pain is what we call a stagnation of energy. The energy of our body is meant to flow freely. This is a very similar idea to the concept of blood circulation, but it's not simply about the blood vessels. It involves the energy that needs to flow through the channels of the body to maintain health. So we need to have energy flowing through the main channels, the divergent channels, the collateral channels, which all together covers an extensive energy network covering the entire body. Now, disease in the sense of internal disease, by this I mean not simply a trauma or an externally acquired virus, something like that. These internal diseases, they are starting initially at a more subtle level, meaning often they're beginning within the channel. And we know this happens when people have pain, but doctors can't find anything wrong. As Oriental medicine practitioners, we can often pick up on these patterns by looking at their tongue, looking at the pulse, and correcting it by strengthening the channel energy where it is weak or clearing it where it is blocked in the case of a pain issue. By correcting the issue on the more subtle level, this will prevent the disease from progressing into a more manifest presentation, such as would be found on an MRI or an X-ray or an ultrasound. Now, either way, whether the pain issue has progressed into something more manifest, we can tap into the body's inner resources, meaning by using acupressure or acupuncture to stimulate the flow of energy in the body, by knowing which points to use to open up the blood flow in that particular area. Now, when treating pain using channel theory, it's important that we first understand which channel is the sick channel. And from starting there, we use that knowledge to decide where to do the acupressure or the acupuncture. This is really the best way. So in this way, we aren't treating every knee pain case the same, because they're not. I know this goes without saying, but I'm just saying this so people understand that it's not just one formula for knee pain that we're looking at. Now, I'm going to go through some of the most common areas that I see people having knee pain, and I'm going to suggest a couple of acupressure points to treat those. Many of the patients that I see are having knee pain at the front of the knee. So I'm just going to show you here the channels that run through the front of the knee. Here we have the stomach channel, and then more on the inside here we have what's called the spleen channel. So let's just have a good look at those for a moment and try to locate on yourself where your knee pain is. I always ask patients to point to the worst area of pain using one finger. This really gets precise so that I know which channel is affected. Now there could be more than one, that's fine. Understanding that pain will move around, a very diffuse pain that's kind of hard to pin down. What happens with treatment is the area of pain becomes smaller and more localized and then eventually disappears. It can also go the other way. It can start to become more diffuse, spreading out over a larger area and becoming weaker as it spreads out, and then eventually it fades out. So either way it goes, it's fantastic as long as the pain is clearing. Now let's look at the stomach channel here. This area at the front of the knee, this is called stomach 35. So all the channel points are numbered. Some people go by the Chinese name, but this is the international standard of naming, and this keeps us all on the same page, whoever's listening, you know? So stomach 35 is located in the eye of the knee. So this is just below the kneecap. If your pain is running along this line of the stomach channel, the first place you're going to look to do your acupressure is at a point on the opposite elbow, okay, called large intestine 11. And now I know you're probably thinking, why are we going to the opposite elbow to treat the knee? How does that work? So I like to use the example of turning on a light switch. When you walk into a room and you want the light on, you just flick the switch at the door, right? And that switch is nowhere near the actual light. So from this, we can see how distal acupuncture or acupressure works. Yes, it works quite well. It's a system of acupuncture called distal acupuncture. So these acupressure treatments are based on the knowledge of acupuncture. So what it does is it causes the body to send more blood, more oxygen, and more nutrients to the intended location, all without having to press in or needle into the injured area, which is likely quite tender. Now, for most people, that's quite nice. We can leave the painful area alone. With the elbow flexed, the point is on the lateral end of, you know what, I think just to keep things simple, I'm just going to explain it this way. You're just going to the end of this line here called the cubital crease. Okay, so where that line ends, with your elbow bent, that's large intestine 11. So just pressing into this area here and seeing if there's any tenderness. And if so, that's where you're going to do the acupressure. So you can spend a couple minutes in this area. Now, if this area, large intestine 11, doesn't feel painful or provide any relief, then we can try another point also on the elbow, a point called pericardium 3. Now, with this point, we can use either left or right elbow, doesn't matter. What we want to find is the more tender spot. So let's just locate that point now. So this is also on the transverse crease of the elbow where we've been also working, and we're just going more inside to this tendon here called the biceps brachii, and going on the medial side of that tendon, okay, right here, that is pericardium 3. So just pressing in and around this area until you find tenderness, and if you do, it means you've hit the jackpot. So you can just apply some acupressure here. You can also try the other side, and left or right, just go with where it's painful. The pain will move, right? So, you press into an area and then the pain relieves, then you can check your knee and see if your knee pain is relieving, if is it moving. Just check how it's doing, either by standing up or moving around. Now, if it moves location, this is very normal and a good sign, because if we can get the pain to move, then we can also get the pain to move out of your body. And the pain may also move to another area of your knee. So let's go back to this picture of the knee here. Now, if your knee pain is on the inside of the knee, this area here is called the spleen channel. So running along this line here, this is spleen 9 and 10. Often people will feel pain here right at spleen 9. This is quite common. It can be further up as well in this inner eye of the knee called Yiyan. And the reason I talk about pain running along this line is that the channels of the body are all running along lines. They're called meridians. Now, if it's your spleen line affected, then the first place you're going to go is your opposite elbow to a point called lung 5. So let's find that here. This is on the cubital crease again. And now finding the biceps brachii tendon, and then going on the lateral side of this tendon now. Now, if lung 5 area is not tender or active on your opposite elbow, then we're going to test another point and see what we find. So now we're going to look at a point called small intestine 8. So now this is on the medial aspect of the elbow, so the inside of the elbow. Now it's in a depression between these two big knobby round bones here on the elbow. This is the olecranon, big elbow bone, and then the other more inside bone called the medial epicondyle of the humerus. So the space between these two round bones here, this is small intestine 8. So we can either do this on the left or the right. We're just looking for the most tender spot. And we can work that for several minutes. And then we can stop. After we've been treating for a few minutes, we can stop and ask ourselves, where is the knee pain now? We can get up and walk around and see if it's starting to lighten up. See if it's easier to move our knee, if that's been something we're having. Now, another area people have a lot of pain is on the inside of the knee. This is an area kind of almost behind the knee called kidney 10. So to find this point, we have to bend our knee a little bit, and then we're going in here where we're going to find two tendons. So tendons, they're not bones, they're sort of wiry, a bit spongy. They're kind of a little bit more soft and flexible than a bone. So just feeling in here, you're going to find two tendons called tendons of the semitendinosus muscle and the tendon of the semimembranosus muscle. Now, they're both very close together. And now you're going to go between these two tendons and right behind the knee. This is called kidney 10. And for some of you, this is going to be a very tender spot. So just go easy in here. Now, if this is your area of pain, we're going to go to the opposite elbow again. And this time we're going on the inside of the elbow. Now, with the elbow flexed a little bit and looking at that elbow crease, And then just going to the end of the elbow crease, just the end of this line here. This is called heart 3. So just pressing around heart 3 for a few minutes. Now, if heart 3 isn't tender, then the next spot we're going to go to is called triple energizer 10. Other areas, people call this triple warmer 10, or in Chinese, sanjiao 10. They all mean the same thing. So this point could be either elbow. Now this is on the outside of the arm. When we flex the elbow, this is in a depression just above the tip of the elbow, one sun, which means 2 of your fingers above the tip of the elbow. Now if you just trace your finger along here, you'll find a little depression, and that's where you want to go. That's triple energizer 10. So just working this point if it's tender. If not, you can try the other side. So even though I'm naming the actual points, which, you know, you can go find them on an internet search if you want some more help in understanding how to find these points, but I just want you to know that precision with these pain treatments, precision of the point is not the most important thing. The most important thing is that you find the areas on your body that reduce the knee pain. So if you're not exactly on point, but a little left, a little right, a little up, a little down, and it's very tender and it's working, that's more important than textbook location. Okay, so just to let you know that. Now, this system of acupressure, acupuncture is quite extensive, and I can't go through all the points here, but this would be my starting point. This is where I would go if you were to come into my clinic. So these points work very well if we persist with them over time with acupressure. I recommend doing this acupressure for a few minutes if you can, and repeating this treatment several times a day. If you're really in a lot of pain, I would recommend, every few hours you do this. Now, of course, with acupuncture, it's less painful than acupressure. That might surprise you, but honestly, I do both in my practice, and I can tell you that the needles are very fine, and especially if you get someone who does Japanese or Korean style, someone who uses Japanese or Korean style needles like I do, often people don't even feel it. They don't even know it that you've put the needle in. So you may prefer to just get an acupuncture treatment because it's just simpler and faster, and the results will be more powerful because we can also balance other weak systems in the body. So that will help you further your healing. Now, I hope this video has been helpful to you all and that your knee pain gets better and better. And I look forward to seeing you in the next video. Thank you.